And to updates on the coronavirus pandemic, in the lowest daily number of COVID-19 infections in months, Nigeria has recorded 506 new COVID-19 cases. Now, 20 more deaths have also been recorded. In a first for Ondo State, it recorded the highest daily infection of coronavirus since the outbreak of the disease in Nigeria last year, topping the list of states with 90 new infections. And Lagos had only 22 cases, the lowest in recent times. Other states with high case counts include Kwara with 89 cases, Rivers recording 53 cases, and Borno with 45 new cases. And joining me now to discuss the effectiveness of lockdowns amongst other measures in tackling the spread of COVID-19 is an infectious disease expert, Dr. Getty Chimeka Anyanwoke. Good to have you join us. Now, the federal government has been touting a second lockdown if Nigerians do not adhere to the COVID-19 protocols. We've seen lockdowns in places like United Kingdom, Australia, New Zealand. How really effective is this, especially when it comes to Nigeria in curbing these cases? Right, like we do not have an audio from Dr. Anyanwoke. We will try and connect again, reestablish connection. All right, we do have her now. All right, go ahead. I don't know if you had my question. If you did, then just go ahead.
I said, I believe that lockdowns have been very effective worldwide, especially when you have the spike in infections. The issue is that you can't keep people on lockdown forever. If we can just follow the advice to wear face masks, to do social distancing, to wash our hands frequently, use sanitizers, those things are good enough to get us to resume our usual way of having commerce and other things that we do in the community and the society. But because some people will observe these things and some others wouldn't, then it increases the rate of infection amongst the people. And at such times, the governments have to take measures like lockdown, where it forces people to be at home. But I think that we can safely resume different aspects of our society in various degrees if we just observe these mitigations that we keep talking about, these measures to help us with mitigation.
So one of the things that was also said, I think by the PTF, was that areas with a higher burden of this virus could be targeted. We could have a targeted lockdown in these areas. But when you look at the fact that our airspace is still open, how effective is that? How does that work?
So again, it's targeting, right? Because usually people that are coming through the airspace, they get tested. That's not going to arrest that situation, but at least it will decrease it a little. Because if somebody was just exposed to the virus a day or two earlier and they're doing the test, they may be false negative, okay? And then a few days later, it might show or they may have symptoms. But at least it helps us to decrease the amount of the infection coming in. I know that we have all been battling this since early 2020. At some time, there's going to be fatigue, and in fact, there is already fatigue. People are tired of it. So what we need to do is to continue to observe those measures for mitigation that we have talked about. We can't shut down the whole of world economy altogether. But if we just wear masks, if we just wash our hands frequently, if we observe social distancing, this is enough to mitigate this infection until we get enough vaccines for everyone.
All right, so I mentioned the airspace earlier because in the United Kingdom now, they have now discovered about 4,000 variants of this virus. And they are able to do that because they carry out genome sequencing over and over again. Do we have that capacity in here in the country to know where we are at, especially with the new variants of this virus, which are said to be more transmissible?
Okay, so I'm going to talk a little bit about viruses and variations. Viruses are always mutating. That's their nature because they are such simple organisms. So when they mutate, for the most times, these mutations are inconsequential. However, they might have enough mutation, which is changes in their genetic code, that may become significant. And that's what we're seeing with the UK variant. The UK variant is more transmissible. It's not necessarily, we don't think it's that severe. It's more severe than the old strain. Although there was a study, I think it was a SAGE study that came out sometime in January, and they thought that that might be what it's telling them, that it's more severe. So to come back to your question, the mutations, there have been more than 4,000, but the ones we're concerned about right now are 3 different mutations: the UK variant, the South African variant, and the Brazil variant to a small extent. The fact is that the same mitigation I was talking about, wearing face masks, washing our hands, social distancing, all those things will help us to decrease every one of these variants. And that's what we need to recognize. We need to continue those measures. Opening up this airspace, in my opinion, as long as it's been targeted, people are checked, people are tested before they travel, that also would help with the mitigation.
Absolutely. And we hope that people are listening, because we continue to see this lackadaisical attitude towards the protocol. But I want to ask you about the vaccine, because you mentioned it earlier. South Africa is now going to be halting its purchase of the AstraZeneca vaccine because of this new variant, because of the new variant in South Africa. Should we also do same to ensure that whatever we are getting is good enough for whatever variants we have in the country?
So I would say, because it's taking so much time to get vaccines to people, people should still be vaccinated. I do not think that we should halt it. Yes, the South African variant seems to, because of the way of the mutation, right? So the neutralizing antibodies, which is what you get either by natural infection or immunization. But for that particular variant, it seems to be missing recognizing it very well. So I know that the Johnson & Johnson vaccine that just came out in the US, it's not yet approved, but they filed for FDA approval. It had about 57% efficacy for the South African variant. And so you will see for different variants, it had different percentage of efficacy. But what it also showed was that it was effective in preventing mild to moderate and even severe coronavirus disease, actual disease in people. So because of that fact, I would say that we should go ahead and get, if we get the AstraZeneca vaccine, which I think is what is being promised to Nigeria for now, people should go ahead and get vaccinated. At least it will prevent mild to moderate and even severe disease in a lot of the people that get the vaccine.
Infectious disease expert Dr. Gertrude Ayaoke, thank you so much for making sense of this for us.
Thank you.